So I'd like to start this session by bringing it back to people being at the heart of everything we do. Can you talk a bit about that link between people's health and planetary health?
I'll talk a bit about kind of our overall strategy first from a sustainability point of view. And our organisation is fully driven by that purpose to help people to live longer, healthier, happier lives. And now we added to that, as you said, to make a better world. And we did that because we know that you cannot have healthy people if you don't have a healthy planet. And based on that, we have 3 big pillars to our sustainability strategy, which is all about, number 1, doing no harm to people or planet, but also going to doing more good in the communities where we all live and work. And so the first big pillar of that is it's all about people. So how do we support millions more people to have access to affordable, but really importantly, preventative healthcare? And the most sustainable form of healthcare is that which doesn't need to happen, or where it's minimised, or where it can happen faster through things like connected care. So that's our first big pillar. The second big pillar is all about how can we work with others to champion healthier and more inclusive communities. Where we live plays a really big part in that. So what can we do to build healthier communities? And then the third piece is about what can we do at Bupa to reduce our own impact on the planet, but also work with other healthcare partners to invest in regeneration. Why the focus on healthy cities? So this is crucial for us because cities provide a blueprint for how overall we can build healthier societies for everybody. There are about 50% of the global population live in cities today, and that's set to grow to about 70% of the global population will live in cities. So cities are at the forefront of this. They're often hardest hit by the effects of climate change. And if we can design health and climate resilience into those systems, it will play a really big role in improving health outcomes, but also climate resilience. And business have a massive role to play in that. You know, most of us work in the cities, so huge opportunity for us there.
And I think working in collaboration with the corporates and partners in the audience really helps us achieve those as well.
Anna, so when we're looking at sort of organisationally, how can we practically integrate preventative health into their wellbeing plans?
How can you create strategies which actually are fun and engaging, designed from the bottom up, as well as actually listening to your people about what's going to help them? So, and I think really kind of putting prevention, but also health creation at the heart of this as well. So, you know, doing things that make us feel better. And also doing it in a way where we support one another as teams as well.
So, Healthy Cities Challenge, very exciting. Perhaps first start with how people can get involved.
Yeah, so I'll just talk a little bit about what the challenge is. But first of all, to say it is such a fantastic way to engage people in their own health, but also in their community's health and the planet's health. So at the most simple level, you're kind of stepping up for your own health. So we run a challenge in June, but we also can run it in other parts of the year. We're doing one right now, as you said, Jumpstart January. Let me know if you want to get involved. So at the most simple level, it's the movement challenge. So you're moving to improve your own health. But you don't have to just do walking or running. If you're in a wheelchair, you can record your wheelchair pushes. If you're a cyclist, you can convert that activity. If you do yoga, whatever it is, you can convert that. And then, as Naveen said, you're not just stepping up for your own health, you're actually stepping up for your communities and your planet's health as well. So what those steps, that movement does is unlock funding for the charities that we work with, but also with some of our corporate partners, we've supported their charities and the things that matter to them. So we've invested in partnerships like our work with the amazing charity Groundwork, so supporting hundreds of projects across the UK to create greener playgrounds, to invest in green spaces in local communities, but also working with Trees for Cities here in London to plant thousands of trees in particularly deprived parts of the city where the canopy cover is lower than it should be. And this has a really big impact in terms of the urban cooling that is needed, but also sequestering carbon, but also tackling air pollution as well. So really amazing that we're not just stepping up for our own health, we're also stepping up for the planet's health.
Really clearly come through that people and planet are deeply connected. And of course that healthcare has that vital role, as you were saying, about playing the part of reducing environmental impact and how crucial that is.